Hello,
Hello.
my name is Monica, one of the nurses here. Could you please give me your name?
Yes, nurse. My name is John.
And how may I address you?
You can call me John.
Alright, John, how can I help you today?
Well, nurse, I don't know, nurse. I don't really understand what's wrong with me at the moment, but I've been experiencing these sharp chest pains. I don't know what these are, but I'm quite worried about them.
I see. Well, try not to worry, John. I will try my best to help you out. Now, before we proceed further, would you mind answering a few questions of mine so that I have a better understanding of your problem?
Sure, nurse, I can do that.
Alright, John. Now, these sharp pains that you mentioned, could you give me a bit more information about them? Like, what exactly have you been experiencing?
Well, I've been experiencing these episodes of shortness of breath, and I tremble a lot, and I feel like my heart is pounding very loudly, and there's this chest constriction and this sharp pain, like I mentioned earlier. So there's all of that happening, nurse.
And how long do these symptoms usually last when you experience them?
Well, sometimes they last for about 20 minutes, nurse.
I see. Have you experienced something similar before, John?
Not that I recall, nurse, no.
Alright, John. So, what you have told me so far is that you have been experiencing shortness of breath, trembling, loud heart pounding, chest constriction, and sharp pain. You have never experienced these before, and these usually last up to about 20 minutes at a time. Is that right, John, or would you like to add something to that?
Well, I think you've got it all, nurse, but I don't think there are any other symptoms.
Well, I would like to tell you, John, that what you have been experiencing is called a panic attack. It's important to understand the triggers for such kind of problems. Can you think of anything that might be causing these attacks for you, John?
Well, I think I have an idea, nurse. I mean, I have an important exam coming up in 2 months' time, and I do feel quite anxious about it. So, do you think that could be causing these?
Well, yes, John. First of all, thank you for sharing that with me. And yes, I do believe that that might be the reason behind these panic attacks. Now, although I understand why you're experiencing such problems, I want to reassure you that it's quite normal to feel anxious, fearful, and nervous before any big events such as an important exam. All right, John?
I I don't know, nurse. I think the panic attacks might be happening due to some big problem. I feel like these might be indicative of something else that's going on with my body that I just need to know. I want to be sure about this.
Well, I understand your concern, John, but I would like to assure you that such symptoms are quite common before exams, and the good news is that these symptoms can be managed with some self care. Would you like me to discuss those with you, John?
Yeah, definitely, nurse.
Well, first of all, whenever you are feeling such symptoms, the first thing that you can do is you can try going to a quiet space and visualizing something which is peaceful for you. That's different for everybody. All right. And the second thing that you can do is you can practice healthy habits such as resting, eating well, getting enough sleep, because these have proven to be quite effective in treating these symptoms. So, will you be willing to try these, John?
Yeah, sure, nurse. I will definitely try these things. But is there anything else that can be done to, make sure that I get some relief from these problems?
Well, yes, certainly, John. I can recommend you some exercises for relaxation and breathing, because essentially what you're experiencing is nervousness and anxiety. So, these would help you out quite a lot. Many of my patients have said that they have helped a lot with their symptoms. But I would want you to return to the community health center every week. Would you be able to do that?
Um, I can do that, nurse.
Well, I'm glad to hear that, John. Now, do you have any other questions that I can answer for you?
No, nurse, I don't have any other questions.